Hello, I'm Tim Timmons with the Lancaster County Health Department, Communicable Disease Program Supervisor, and I'm here to talk about flu with you. It's currently coming into the end of January, beginning of February, and flu activity in Lincoln and Lancaster County is very high at this point in time. We're seeing a lot of individuals coming down with flu in the state, and also locally we've had some deaths due to flu this season. The current influenza virus that's circulating is primarily an H3N2, which tends to cause more severe illness in individuals who get infected with the virus. There are other types of strains of influenza that's circulating. The other major one is a type B influenza. Our primary means of prevention in terms of reducing your risk from influenza is getting vaccinated. It's never too late to get vaccinated against the flu. Vaccination will reduce your risk. It may not be 100% and eliminate your risk completely, but it'll reduce your risk of getting severe infection or developing complications from the flu. Individuals who are at high risk for complications, we really encourage you, if you have not already been vaccinated, to do so. You can't get influenza from the vaccine. The vaccine uses a killed virus. It can't give you the flu. The other thing people think is that they have the flu, and when we ask them what symptoms that you've had, they'll say vomiting or diarrhea. Now, what they're referring to is a lot of times called stomach flu, which really isn't the flu we're talking about. The immunization, and flu immunization will not protect you against stomach flu. That's a whole different thing than the influenza we're talking about, which is respiratory. And it is respiratory, and sometimes it can be confused with having a cold. But there's a difference. With colds, they tend to come on gradually. You may get a stuffy nose, head cold, what we call a head cold, sore throat, and then eventually it goes into the chest and you develop a cough. And a lot of times it's a productive cough. When you cough, you bring up mucus. That's a cold. With influenza tends to be sudden onset. You may feel fine, go to work, and be doing fine, and then by mid-morning or afternoon, all of a sudden you feel like you've been hit by a Mack truck. Your chills, achiness, fever. Usually fever is going to be a high fever, but it can be sometimes low grade. And just fatigue. Eventually a cough will develop, but the cough is a non-productive cough. You won't be bringing up anything when you cough. It'll be a non-productive cough. And again, symptoms may last 3, 5, maybe 7 days for some individuals. Individuals should not go back to work, to school, or to childcare until they've been fever-free, not on any fever-reducing medications, for at least 24 hours. That way, once they go back, they're no longer at risk for transmitting to other individuals. Other things individuals can do related to flu is wash your hands frequently during the flu season, cover your mouth when you cough, in your sleeve, your nose when you sneeze. If you do develop symptoms of influenza, stay home. Avoid being around individuals who are at high risk for complications due to the flu. Those individuals who live in the same household as an infant under 6 months of age that can't be vaccinated need to be vaccinated. We really encourage you to be vaccinated. And individuals who care for infants should be vaccinated. Because what you're doing is, because you can't vaccinate that infant under 6 months of age, you're doing what we call cocooning around it. You're protecting that infant by making sure those who are around that infant on a daily basis are protected and reduce their risk of getting it and then giving it to that infant. And again, child care providers who have infants in their care, the importance of being vaccinated as well. It's important to reduce, particularly very young children, 2 and under, exposure to flu. So don't be taking them, our recommendation would be avoiding going out into crowds, to malls and stuff where there's lots of people when there's a lot of flu going on in the community, to reduce their risk of getting exposure. And that can be true for other older individuals, other people at risk. So the important thing is to take measures to protect yourself, and the primary means of prevention is immunizations, and it's never too late to be immunized for flu. And take those other precautions in terms of hand washing, covering your mouth when you cough, your nose when you sneeze. And then remember, if you get symptoms of flu, if you're at high risk, contact your healthcare provider and maybe get on an antiviral medication to reduce your risk for complications and the severity of the illness. If you're a healthy individual, stay home, stay down, take care of yourself, avoid being around individuals who are at high risk for complications due to the flu. And once you're fever-free for 24 hours off fever-reducing medication, you can go back to your normal activities. You're not at risk for transmitting to other individuals.